The major objective of the APhA ASP National Patient Counseling Competition is to encourage student pharmacists in their efforts toward becoming better patient educators. The competition is designed to reflect the changes occurring in pharmacy practice to promote and encourage further professional development of the student pharmacist and to reinforce the role of the pharmacist in improving medication use and advancing patient care. The competition begins on the local level as students compete to be the national representative from their school or college of pharmacy. The competition on the local level may be funded from a variety of sources such as official college funds, locally obtained funding, state association support, and student fundraising activities. Both the locally awarded prizes and the travel expenses for the winner to compete in the national competition will be the responsibility of the school or college of pharmacy. Each of the top 10 finalists that compete in the final round of local competition will receive an award, compliments of APhA, ASP, and CVS Caremark. Once the local winner from each school or college of pharmacy is decided, this individual will schedule an appointment to compete on the national level at the APhA 2013 Annual Meeting and Exposition in Los Angeles, California. The national competition is divided into preliminary round and final round. During the preliminary round, students select a practice scenario at random and are required to counsel a patient on the appropriate use of the drug involved. Students are then given time to refer to the reference sources available in the model pharmacy. After consulting the references and determining the appropriate information for the patient, the participants counsel the patient. Evaluations are based on the content and style of counseling presentations. The 10 highest scoring participants are then invited to the final round. The final round involves a more complex counseling situation where the participants again select a prescription at random and are asked to counsel the patient on safe and effective drug use. In addition, the patient in the final round will display personality characteristics such as anxiousness, belligerence, or apathy to challenge the participant's ability to convey pertinent information in a realistic situation. The top 10 finalists in the national competition will be recognized during the APhA ASP award ceremony and will receive a prize compliments of APhA ASP and CVS Caremark. The 4 top winners of the national competition will also receive cash prizes. The APhA ASP National Patient Counseling Competition for Student Pharmacists is conducted in partnership with CVS Caremark. Following is the counseling session of the winner of the 2012 competition.
Hi, I'm here to pick up a prescription.
Hi, what's the name of the patient?
Joe Babcock.
Joe Babcock, and are you Joe?
Yes, I am.
Okay, Joe, I'm Stacey. I'm the pharmacist that filled your prescription today.
Okay.
I'd like to take a few minutes to talk with you about it if you have a few minutes.
Sure.
Can we do that? I'll have you sit down here.
Okay.
And the purpose of this session is just to make sure that you know how you're going to be taking your medication. I'm going to give you a few things to expect and a few things to look out for.
Okay.
And then make sure any questions or concerns you have get addressed before we send you home.
Okay.
Okay? And before we start on your prescription, I just want to make sure that we're up to date on your patient records.
Okay.
I do show that we've got you here on Northwest Music Street.
Right.
And current phone number?
Yes.
Okay. And I do show we have an allergy on file to penicillin.
Yeah, I got a real bad allergy to penicillin.
Okay. Any other reactions that you know of, just the penicillin?
Just the penicillin.
Okay, and then I also see we have a long time history of simvastatin and hydrochlorothiazide.
Right.
Still on both of those medications?
Yes.
Great. And I did notice you're very regular about picking up your refills, so that's commendable. And then are you still taking the ibuprofen?
Yeah, I take it for my headaches.
You are?
Yeah, probably a couple times a day. Not every day, but 3-4 times a week probably.
Okay. Do you take any over-the-counter supplements or vitamins, anything herbal products?
No.
Okay, perfect. If you ever do start taking an herbal product or something over-the-counter, it's always good to check with us or your physician. Just make sure it's not interacting with anything else you've got here.
Okay.
Okay? So it looks like Dr. Pham sent over a prescription for you. It's for the Indocin. You can look at this with me too.
Yeah.
The Indocin 50 milligram capsules.
Right.
We filled it for the generic, which is endomethacin, and that's what you've got here. They're just little kind of teal colored capsules, so you know what you're getting into.
Okay.
Is this a medication that you've taken before?
No.
Okay, and then what did Dr. Pham tell you about why you're going to be taking this medication?
Well, I've got this really bad and swollen toe, painful toe, and he told me I had an acute gouty attack, so he told me I was to take that to help control the pain.
Perfect. Yeah, we see this one a lot for gout. It's a very strong anti-inflammatory drug, and so it will help resolve all that inflammation and pain until your body can help catch up and resolve the gout attack.
Oh, okay.
Okay. One thing you are going to want to know about this is it acts in a very similar way to the ibuprofen that you've taken. So you're not going to want to take that at the same time while you're on this.
Oh, okay.
Okay. You also don't want to take any aspirin while you're on this. They're similar as well.
Okay.
Okay. They're going to have you taking, and your directions are right here on the bottle, 1 capsule by mouth 3 times a day until the pain is resolved.
Okay.
So that'll be about 8 hours apart, morning, afternoon, and evening.
Okay.
We're about noon today, so you could certainly take one this afternoon, 1 tonight, and then start 3 times a day tomorrow.
Okay.
You absolutely want to make sure to take this one with food. It can cause some upset stomach.
All right.
And a full glass of water.
Okay.
If you do miss a dose, go ahead and take it as soon as you remember. If it's getting kind of on towards when your next scheduled dose would be, go ahead and skip it. We don't want you to take 2 at the same time or too close together.
Okay.
So skip it, just move on to your next dose.
Okay.
And you're only going to take it until your pain is resolved, so you don't have to take the full 30 capsules.
Okay.
And no refills on here, so it's just a one-time deal.
All right.
Just to make sure I didn't miss anything, can you tell me how you're going to take this medication?
I'm going to take it 3 times a day, take it with meals and a glass of water. If I miss one of the things, if it's not too far, I can catch up.
Perfect.
Okay.
Excellent. Now, a few things I do want to caution you about. We talked about this can cause a little bit of upset stomach, and so that's why they recommend you take it with food. It also can cause a little bit of a headache in some patients. It's not common, and if that comes up, usually it'll resolve after a day or 2, so try to be a little bit patient with that.
Okay.
Okay? If you do have a headache, you could treat it with Tylenol, but again, no ibuprofen or aspirin while you're on this, or leave.
Okay.
Okay? And then one major thing I do want to concern you with, we talked about it causing some stomach problems. In a very small number of people, it can cause ulcers. So just watch for that. If you did have trouble, you'd notice really upset stomach, and then if you were to vomit, a coffee ground type texture in your vomit, okay?
All right.
Now, what concerns or questions do you have about this medication?
I want to know how soon it's going to start working because my toes really bothering me.
Absolutely. So usually within the first couple of doses, even by the time you go to bed tonight, you'll start to notice a difference. By the middle of the day tomorrow, you should be getting the full effect.
Okay.
So relief should be on the way. I would guess you'll probably be taking it for 3 or 4 days before you're able to stop entirely.
Okay.
Okay?
All right.
Any other questions for us?
I don't think so, not right now.
Okay. I do want to remind you, when you get this home, store it in a cool and dry place in your house where children can't get to it if you do happen to have children in your home or some coming over.
Okay.
Okay? And then if anything else does come up, our number is right here on the label, and I'll urge you to call us. We're happy to help you with any questions that you do have. Okay? And my name's Stacey. I was, again, the pharmacist that filled this, but any pharmacist that's here is happy to help you.
Okay, great.
Okay? I'm going to hand that over to you, and thank you so much, Joe.
Thank you.
Have a good day.
All right, bye.
For more information, contact the APhA Student Development Department located at 2215 Constitution Avenue in Northwest Washington, D.C. 20037. The APhA Academy of Student Pharmacists, with over 33,000 members from the 123 schools and colleges of pharmacy nationwide, is a subdivision of the American Pharmacists Association, the National Professional Society of Pharmacists.